Today, discussion about dissociative disorder, psychogenic amnesia, fatigue, multiple personality disorders. Dissociative disorder or mental disorder that involve experiencing a disconnection and lack of continuity between thoughts, memories, surroundings, action, and identity. People with dissociative disorder escape reality in a way that are involuntary and unhealthy and cause problem with functioning in everyday life. Dissociative disorder usually develop as a reaction to trauma and help keep difficult memories at bay. Symptoms ranging from amnesia to alternative identities depends in part of the type of dissociative disorder you have. Times of stress can temporarily worsen symptoms, making them more abuse symptoms. Sign and symptoms depends upon the type of dissociative disorder you have, but may include memory loss of certain time periods, events, people, and personal information. A sense of being detached from yourself and your emotions. A perception of the people that and things around you go as destroyed and unreal. Mental health problems such as depression, anxiety, and suicidal thoughts and behavior. If you have a thought of hurting yourself or some else, call 911 or your local emergency number. Immediately go to an emergency room or confide in a trust relative or friend. Causes dissociative disorder usually develop as a way to cope with trauma. The disorder most often from in children subjected to long-term physical, sexual, and emotional abuse or less often a home environment that's frightening or highly unpredictable. The stress of war or natural disaster also can bring on dissociative disorder. A child who learns to dissociate in order to endure a traumatic experience may use this coping mechanism in response to stressful situation throughout life. Risk factor. People who experience long-term physical, sexual, and emotional abuses during childhood are at least the risk of developing a dissociative disorder. Children and adults who experience other traumatic events such as war, natural disaster, kidnapping, or extended traumatic early life medical pressures also may develop these conditions. Prevention. Children who are physically, emotionally, or sexually abused are at increased risk of developing mental health disorders such as dissociative disorder. If stress or other personal issues are affecting the way you treat your child, seek help. Talk to a trusted person such as a friend, your doctor, or a leader in your faith community. Ask for help locating resources such as parenting support group and family therapist.